So for years and years, we were putting women on it without symptoms just for
My mom was on it.
bone protection.
I remember my
you
mom
know,
being on it.
Which makes total sense.
Yeah.
That was the one good thing that Premarin did have. So in the positives, it was decreasing the risk of osteoporosis and decreasing, fractures, but then it was doing all these bad things with heart disease, stroke, and breast cancer. Women were dying.
You didn't build your clinic to feel like an employee in your own business. I'm Matthew Galogli, and on Out of the System, hosted by Dr. Talks, we challenge the broken rules holding healthcare entrepreneurs back. Hear from clinic owners, rebels, and builders who are creating bold, profitable, patient-centered practices and doing it their way.
Okay, so you're having Topo Chico on the way to the airport?
In the airport.
Oh, in the airport. And you put a little salt on it.
Yeah.
Do you carry like a little tin of salt?
No, but you go, any kind of fast food place or whatever has a little salt, your little white thing with the red salt label on it. So you put a little bit on the edge and got your little margarita right there.
Well, in case you're listening, your first time listener, you might be wondering, are we talking about drinking margaritas? Sort of. But actually, I'm here with Dr. Aimee Duffy, and she's in beautiful Clemson, South Carolina, and longtime client, alum. And tell everybody what you do.
Yeah, I am a functional medicine, integrative medicine doctor, family practice by trade.
Sorry. I'm just kidding.
Yeah.
I'm just joking.
I'm glad that I did that, actually.
No, I know.
Yeah, sometimes I actually will tell a patient I'm embarrassed to be a doctor sometimes, but at least I have some credibility behind my name, I think. And, I appreciate having the science behind what I do so I can more understand.
Yeah. How long have you been in the functional space?
Most of the things that.
How long have you been in the functional space?
15 years. So my practice is
Really?
Carolina Integrative Medicine in Clemson, and in October we'll be celebrating 15 years.
And it's been a piece of cake, right?
Oh, yeah.
Yeah, no problems at all?
Never, ever, ever.
Never any financial challenges? Yeah.
It was a mess.
Well, okay. So explain what do you mean by that?
One, and I feel lucky in a lot of ways. I did family practice, but I did a rural residency program in Seneca, South Carolina, which is 6 miles down the road from Clemson. And we did a ton of OB. So by the time I finished my practice, and the 4 other residents that were in this program didn't like OB at all, so I got to do all of their babies too.
And you were pregnant at the time, weren't you?
I've had 2 babies.
While you were
one in med school. 3rd year med school was baby number 1. 1st year of residency, baby number 2. So
you're just a really keep it simple kind of gal, right?
Yeah,
no complexity.
Nothing can be easy.
When you tell me those stories, I'm like, first of all, how do you make it through residency? Second, how do you make it through residency pregnant with already a little one at home?
Already.
Yeah.
Yeah, at that time, their dad would bring both of them to the call room and just sleep in the call room so I could go breastfeed the baby, in the few minutes in between the ER or whatever I was doing at the time. And then I got in trouble for doing that, and so they had to not come anymore.
Whoops.
Just, they didn't, apparently I was, nobody was like dying while I was breastfeeding my baby, but, it wasn't kosher because other people weren't taking breaks like that. So, right when I was in residency is when they did the 80-hour work week rule. So I was like a 3rd year resident when that came out. So if we were in the hospital after midnight, then you got to go home at noon the next day kind of thing. So
wow.
Prior to that, we didn't.
How can you create a great doctor without working 120-hour work weeks? Isn't that crazy?
So when I did family practice, it was interesting. I'll go way back when I was little girl. I loved babies. I wanted to play with all the babies. I had 12 Cabbage Patch Kids, and one of the ladies that babysat me was a seamstress, so she made all Cabbage Patch doll clothes, and I had all these accessories with strollers and high chairs and little food packets and all this stuff. And so I was real into babies. And when I was 11, we went to a pancake breakfast at a park, and there was this like Michelin baby. I mean, he was like bald and just chubby everywhere, like wrinkles everywhere, and I was just in love with him. His name was Alan, and I just walked up and started playing with him on the playground, and he was in the sand or something. He was about 8, 9 months old. And the mom was like, "Oh, he loves you. Like, can you babysit for us?" And I was like, "I'm 11. I don't think I'm allowed to babysit." But that was my first job. So I went over and just was mom's helper. So I just started playing with the baby, and then turned into babysitting once I was old enough. And then she had a baby, and then her sister had babies. And so I was just all in the family. That was my job, my whole from 12 years old through even college, I'd go back home in the summertime and babysit for them. And so when I was a senior in high school, the sister was having baby number 2 and invited me to be in the delivery room with them. And so that was my first like real medical experience.
Had you thought
of
about
any
being a
kind.
doctor prior to that?
I think because I loved kids so much and babies, I thought about pediatrician or a teacher, but I hadn't really made a decision. I played softball and I just knew I was going to go to college and play softball and didn't really have a plan, but I was a good student. And so, doctoring was definitely something that was suggested. And so when I saw this baby be born, and I thought, this is really cool. Like, I want to deliver babies.
And you were 18, and that was the first time you'd seen a baby delivered?
Yeah. First
So
time ever.
that must have been wild.
Yeah, like I had never seen a delivery. I'd never really been in the hospital. Like
It's
my
not
mom
like
had
YouTube
a
existed.
hysterectomy when I
Right.
was like in middle school, and I remember going to the hospital room for like 2 minutes, saw her pushing her little button. That's all I remember,
Yeah,
and then
give me
left.
more morphine.
I didn't spend very much time there just to visit, so I didn't have a whole lot of hospital medical stuff. So I don't have the story about, I knew I was going to be a doctor because of whatever.
Mom and dad were not doctors, not in the medical
No.
field, didn't have an
My
aunt or an
dad was a
uncle.
Lutheran minister. My mom was in software. She was a software engineer, computer geek, so nothing like that. So then I grew up in Boulder, Colorado, so I would say it was rather granola. And so it was like, well, maybe I'll be a midwife.
Right.
And then I was just going to, be cool and like deliver babies at home and stuff. And then my chemistry professor was like, no, you're not. Like, you're smart enough. Like, you should go to med school. You can do that. So I did. I went to med school. I actually took 5 years in college just because I played softball, and I redshirted 1 year due to an injury. And so I just took a lot of ceramics. And
well, of course.
took a whole
Were you in
summer off
Boulder?
to
Where'd you go to
study for the
college?
MCAT,
Were you in Boulder?
Texas Lutheran University.
Okay, Texas
so
Lutheran.
small
Where is
college.
that? West Texas or?
No, it's right outside of San Antonio and Seguin.
Okay.
Just west of San Antonio. No, east of San Antonio. So then I went to med school, and first 2 years normal. I mean, whatever normal med school is, but lots of studying, lots of figuring it out. And then you start doing your rotations. Well, I got pregnant July of my 3rd year of medical school. So like the very first rotation, found out I was pregnant. And so I had to make some adjustments. And so I did all of my hospital stuff at one time so that, I wasn't stuck in the hospital when I was super pregnant. So basically, like I remember going to BAMC, which is Brooke Army Medical Center in San Antonio. I'd walk in, find the bathroom, puke, and then go do my rounds and then puke again. And then it was August, it's the middle of summer in San Antonio. It was like,
which is like being
awful.
right next to the pizza oven in hell.
And our air conditioner went out in the house that we were renting for a while, and we ended up going and staying in a hotel for like a week because I just couldn't. I was dying, like I couldn't be in the room in the house. So, when you're in the hospital, and it was back to it because the medicine and surgery are both 12-week rotations. So it's basically 6 months of the beginning of my pregnancy was all just in the hospital. And when you're in these hospital rotations, I mean, there's no time. Like, I don't even know if their clocks existed, right? Like, you're in the
It's
ER.
like a casino.
It's just,
yeah.
You finish what you're doing, you round at 4 a.m, then you round again at 6, and then you round again at 8, and then you're in the OR all day, and you're just, it just never ends. And so I got to family medicine when I was super pregnant, and it was like, first patient starts at 9, or I don't know what time. Maybe it was 8, but it seemed like it was the latest, of all the times. And then they were like, what are we going to do for lunch today? And then they would have, drug rep lunches, or they'd all go out to eat somewhere from the clinic. And then, last patient's at 4:30. Where are we going? It wasn't all about drinking. It was just like, what's the plan for after, and then they would still be on call. I mean, I don't want to say it was all, rainbows and cookies or whatever, but I mean, it was just cush compared to the hardcore hospital system. And so I thought I was going to do OB because I wanted to deliver babies, but they were all so mean and miserable, and just, it was such an unpleasant experience to be in the hospital and watch these people.
Well, it's because, they're sleeping 3 hours and 48 hours.
They're not getting any sleep. It's just super hardcore. Like when you, I don't even know that there's a movie or a show that you could watch that was realistic enough, ER doesn't even, they bring some stress to it. But in terms of just like the hierarchy, it's like if the chief does this, and it was just so, it was awful. So then that turned me way off. But then I realized that family doctors were delivering babies too. And so when I was like, you could deliver babies and then you get to be the pediatrician, so you get to take care of babies, which is kind of what I wanted to do anyway. And so I got the best of both worlds. I'm like, I'm going to do family practice, then I can do all the things.
But not, was it more of like a specialty where you weren't doing peds though? You weren't doing pediatrics fully. You were just family medicine.
Yeah, well, in my residency, like,
Okay,
you
in
could
the
do all the
residency.
things.
Yeah, okay,
In
all things, yeah.
residency, we were taught everything.
Right.
So in residency was a lot like med school, because for family practice, you do rotations and
Right.
everything. So you'd have a month in surgery, you do a month of cardiology, you do a month in the ER, you would do urology. I think we got 2 weeks of GYN, so that'll come back in a minute, and then a couple weeks of orthopedics. But then you kind of, in your third year, you have a little, some more elective time and whatnot. So you kind of specialize, if you want to call it. So like a lot of family doctors will lean towards dermatology or they'll lean towards sports medicine. So I just leaned more into the obstetric part. And like anytime that I could, I was on labor and delivery. We were a very small hospital and there was only 4 residents. There was 2 a year. And we did our first internship year at a bigger hospital in Anderson. And so by the time the second and third year were there, there's 4 residents in the entire hospital. You could do whatever you want.
Right.
And so, you'd show, if you liked cardiology, you could say, hey, call me when you're doing a cath, I'll
Right.
run down from wherever I'm at. Or, you like doing surgery. Hey, call me when you have a surgery. So I'd be like, call me when you're doing C-sections. I'll get there. I'll do the scheduled C-section every day at 7 a.m. And then I'd go off to whatever my rotation was. So I just did tons of deliveries and just absolutely loved it. So when it was time to graduate, they invited me to stay on at the family practice residency program as an attending position. And that time I was like, absolutely.
Yeah.
I'm loving what I'm doing. Who wants to go interview and try to find a job and move and, all the things again 3 years after you just barely got there? This time I had 2 babies. So I had,
Yeah. I mean, you've got 2 kids, you're married, you've got a
husband had a job at the time that was fine. And so,
must have been like really confirming, or must have been very satisfying or relieving, that you didn't have to worry about all that.
And I mean, flattering at the same time to be, good enough, if you want to call it, to say, hey, we trust you to teach these guys coming up. And so I stayed. And then just months after that, like 6-7 months, the OBGYN guy next door, takes me out to dinner and says, we have an opportunity for you. One of our partners is leaving, moving to North Carolina or something, and we'd like you to join our practice. And, we would share the OB calls. You get to do a whole lot of OB, and then you would just do women's health. You could be primary care. So many women come to us for their primary care.
What year is this?
Women. This is 2006-ish,
Okay.
2007.
And were you familiar with like the functional medicine space or hormones or anything like? Okay.
Not at all.
All right. So
this
this was
it's going, like, I'm
okay.
hardcore normal family medicine,
Yep.
insurance driven, everything. Had 2 weeks of OBG or 2 weeks of GYN, not even OB, but just GYN rotation. I remember having some lecture about birth control and like, here's a chart of like the different types of birth control you might use.
Here's where everything's located.
Yeah. And it's like, really what I joke about is I think that 2 weeks of GYN was what I learned is how to do a pap smear, number one. And then what was in the closet was basically like what was the choice of the day was whatever was in the sample closet to choose for, either birth control or hormone replacement. Like there was very little conversation about it. There was very little science of this. It was very trial and error, just give them this one. And if they, come back in 3 months and they're complaining about something, you just switch them to something else. And like this chart was supposed to be like trying to, help guide you as to if somebody had more acne, choose this one, or if somebody had more whatever, I don't know, choose this one. And so, but it was nothing related to the science or physiology of what was going on. So I joined this OBGYN office and loved it. I'm delivering babies. There's 3 of us. We're on call Q3, 3 weekends a month. We're just delivering tons of babies.
I'm curious, what did you love about delivering babies?
I think it was just so happy. Like it was just, people, I think sometimes in medicine, especially being in the hospital, was scary because people don't want to be in the hospital.
They're
right?
scared because they think it's going to be the end.
They're having a heart attack. They're, chronic disease. It was just frustrating. I mean, post-surgical complications, geriatric people who don't do normal things, I mean, it was just, ugh. And then you go into labor and delivery and it's like, woo, we're
Here
having
comes a
fun over
life.
here. Now, were there times when it was freaking scary and babies died and moms died and, that was not cool. But I think, for me, the good far outweighed some people. That one event would turn them off completely and they'd say, that is just too scary for me. Like, I want nothing to do with that. But I, you know, that didn't bother me. I felt,
How did you handle that the first time? And we'll go more into the but I'm
yeah,
curious about this. How did you handle that the first time you lost a patient like that in delivery, either a child or a mother?
yeah.
And I know you can't talk about particulars, right? I know, but
No,
like,
I mean,
I'm
I can tell stories. I mean, no names are going to be said,
right.
right? So I'm trying to think about first time, definitely like in residency, probably, I think the first time, whether it affected me, I don't know, because I was tired and I had my own babies to deal with. And I remember
Oh
somewhat
yeah.
being scared of my own baby and like the concern about were they going to be okay, as opposed to anything else. And not to say that I wasn't, I mean, sometimes you have to emotionally connect or else you would go insane. I think because I was a resident, it wasn't my fault. I
Right.
wasn't there. I mean, I was there, but I was more
You weren't
observing.
calling the
I was
shots.
not the responsible
Right.
person, so I couldn't. I mean, I could feel sad for the situation, but I wasn't. No, I wasn't feeling like just terrible because I did something wrong. But there was a time I remember, first year residency, I was doing OB, and the attending physician. This is the small hospital still. The attending physician was at another delivery, and so I'm in the room pushing with this other mom, and they started having where the heart rate decelerates,
Right.
and you got to make a decision and do something. And so we had, this is beyond forceps time, so we had the suction cup thing basically that you could put on. And so, I had done several deliveries with this suction cup. So I was like, well, it's right there. The head's right there. I can put this suction cup on and help the mom get this baby out. You could see the heart rate going down. So I did it without the attending in the room. And he had some words for me after that because I was just an intern and I should not be doing those things. But the
Right.
outcome was good, so I'm like, what else should we do? I mean, they were paging you and you couldn't leave because you were in the middle of delivering this other baby. Like, should I just have let the baby die or try to do something, right?
Right.
They didn't like me arguing that way, but
Yeah. God forbid you should
um,
speak up.
no. So and I think I was just really good at it. Like, so I liked it because it was, you know, that's what I wanted to do, right? I wanted to be a midwife. I wanted to deliver babies. I was very calm. I mean, that's just my personality anyway. I was super calm. I wanted things to happen as natural as possible. If they wanted to come and bring woohoo stuff and, hey, can you olive oil my perineum? Absolutely. Like, we'll do whatever you want to, you want to sage the
Because that's,
room, like I grew
yeah,
up in Colorado.
everybody
I'm
should
like,
have
do
they
whatever.
should bring olive oil and put it on the perineum.
Unfortunately, yeah, we didn't have bathtubs or, oh, well, I would have been happy to deliver babies in the bathtub for them, So we did have scary
I'm
moments.
sorry,
So
but there was just a video that came across. It was talking about clitoral stimulation during labor.
yeah,
I'm like, okay, sure, why not? Like,
let's see what happens,
let's
right? I
see
don't know.
what could possibly go
The best
wrong.
one was a mom who named their kid Charles, and they called him Chuck because she literally vomited him out. So, like, vomiting is a really great, I mean, huge abdominal pressure when you're vomiting, and the baby just came flying
All this
out when she's
science, and this is
vomiting,
what we get
it was
down to, is
perfect.
puking
Yeah,
the child out.
yeah.
You
She
know.
called him Chuck. So I'll
So-
tell you, one of the scariest ones was, this is when I was an attending, and the small hospital we had, the anesthesiologists were not in-house. So we had to call them in if we were going to do a C-section. Well, that's really stupid if you're doing an emergency C-section and they're not there.
Yeah.
And so, this was definitely an emergency. I mean, like, things were going downhill fast. And so literally, I'm like, you guys tell me what to do. Like, this is the first time this has ever happened to me. So I didn't have experience with, I mean, I've done tons of C-sections. I've done, plenty of deliveries, but we literally had to just use like lidocaine, and we're put like loads of lidocaine to numb up this mom's stomach,
Are you shitting me?
cut in, and then like basically
Oh.
she passed out at some point.
Yeah, no shit.
Uh,
I'm about ready to pass out.
But I'll tell you that, I saw her after the fact. So the baby had to go to the NICU. Like, this was definitely not a good, like, had we waited even 10 more minutes, I'm not sure
Yeah.
this baby would have lived. and the mom's life was not in danger. I mean, she was just in a lot of pain, but, there wasn't bleeding, there wasn't anything going on. And so, basically doing a C-section with no pain meds, and I don't think they'll come back and sue me because I didn't do
Yeah, it's
anything
bad.
wrong,
Yeah.
but, the anesthesia guy later said, you could, now we're using ketamine for everything, right? Like, he's like, "You coulda used ketamine, that would've been safe for the baby, where you could have knocked her out
MKO melt.
without,
Yeah.
respiratory concerns or anything like that." I'm like, "I don't know anything about that. Like, I'm not anesthesia. Like, we
Right.
didn't learn that stuff." So then I have a whole conversation with him. I'm like, "Teach me what I need to do. Like, I'm writing this down so that if this ever happened again, we don't have to go through that." But saw the mom of this baby, and then her parents came for their 2-week follow-up or whatever, and I mean, they were just super grateful, like, they knew what I did and that it saved their baby's life, and she said she doesn't remember. So, I mean, her body did what it was supposed to do and check out of
Yep.
that
Checked
trauma,
out.
so she doesn't remember anything.
Yeah.
I
Andrew,
would
our
say
second.
that was more traumatic than any other
That,
experience,
yeah, Sarah was having her second, Andrew, and we had Megan's daughter, and then that was a C-section. And then we know that we're having a boy. And so we're like, girl, boy, we're going to be done, right? We're in Pensacola, Florida. And Sarah's like, I want to use a midwife because I want to have the baby vaginally. We're not going to have any more children after this. Girl, boy, we're going to be done, right? And they go through like a couple of days of like trying to do inducement with Pitose. Doesn't, she'd get up to a certain point, then would
Yeah.
stop, then we have to go home, do a start all over again. So she's going through the delivery, and all of a sudden, Andrew gets stuck in the canal. And they had to cut her stem to stern.
Yep.
Sorry, Sarah, you're never going to hear this, but sorry. Anyway.
Yeah.
And like, I just remember her passing out, kind of. They cut her, she passed out, blood splattering everywhere. My son comes out and he's blue. He looks dead. Like, he was not breathing. They had to resuscitate him. And, he's been fine, right?
Yeah.
But theoretically, he's been fine, right? He's a 28-year-old boy. Who the heck knows? Or young man, I should say. But, I find I think we take birth and delivery for granted.
Yeah. I mean, nature's amazing, and that's what, when everybody says, "Can you do home deliveries and all that kind of stuff?"
You can do
And it's
whatever you
like,
want.
you can do whatever you want, but I'll tell you that one moment, and that's like, you know, you don't have time to call 911 or get in the car and get there. Like, it can happen as fast as what you experienced, right? I mean, if they and they did that type of C-section because they don't have time to go through the layers and do it the normal
They
way,
pulled
which would
out a
be
pair of
across
scissors
this
about
way,
this
right?
big and
Yeah,
cut
they
her
just went,
from her ass to her vagina.
"Yep,
Yeah.
we gotta get it out."
Yeah.
And, so, at that point, like, there's no time on the clock. It's just how quickly can we move? So those are the scary moments for sure.
When you were doing that, when you're delivering babies, and did you ever feel slighted that people didn't respect you when you'd be like, "Hey, we're going to do a home delivery," and you'd be like, "That's fine, but we need to have a backup plan." And they didn't. Did you ever feel slighted?
Definitely. I mean, well, we didn't have midwives and stuff in our practice or at the hospital, so we were not involved in any home
Okay.
deliveries, or I didn't have any patients who were telling me that they were doing a home delivery. Now, being on call in the hospital, we would get people who were doing a home delivery with a midwife where things weren't going as planned or whatever, and then the baby would come or the mom would come and we would have to intervene. So I do remember that scenario at one point where, I mean, it wasn't necessarily a bad outcome, but they had been at home with the midwife, like, pushing for hours and hours and hours and no progress. And the baby was fine, and they came, and I think we probably did some either forceps or, some intervention that helped, right? And then the baby's born, but it was having some respiratory distress. Like, we didn't have to resuscitate or anything, but we're like, we need to take him to the NICU. Well, they were just, because their birth plan is home delivery,
Yeah.
like, baby's gonna bond and be
lay
right
on your
there. And
chest.
we're like,
And,
no,
yeah.
he's gone. I mean, they fought and fought and fought, and they were so mad that the baby was in the nursery, on oxygen and whatever. They're like, he's fine, he's fine. When are we going to be able to put him chest to chest? And he's got to breastfeed at some point. We're like, he needs to breathe for, I mean, it was just,
Let's
because
get
this I'm family practice. So now I'm the ped in the nursery just after I delivered baby in the labor and delivery. And so that was just one time that I remember, somewhat being involved in somebody like that where they were just mad at us.
Yeah.
But
Yeah,
I
it's
mean,
I find the whole OBGYN lifestyle
it's a
incredibly.
little, they'd make fun of people who had a birth plan because they're just like, the second you have a birth plan, you're asking for a C-section, right? And they want cookie cut, just like we
Mhm.
talk about cookie cutter medicine. They want obstetrics to be cookie cutter too.
Yeah.
Like one of my partners, if the baby wasn't out by dinner time, he was doing a C-section. It didn't matter whether they were progressing or not progressing. It's like, he'd come and check them at lunchtime and he'd literally walk away and say, set up the C-section room, call anesthesia at 5 p.m. I'll be back if they hadn't delivered yet. That's not nice.
No, that's not nice.
That's not fair. I mean,
But in a way, I understand it. I mean, they work insane hours. I mean, we have a new client. Her husband just was, on call for the weekend. She goes, I don't talk to him for 72
yeah,
hours. He might sleep 5
but
hours
that
the
was
entire
your
weekend.
choice, to some
Yeah,
degree, like
but there is a passion about it,
to
though,
go
isn't there?
into a position where you knew you were going to be on call. It's not like,
Yeah.
you work banking hours 8 to 5 and then people know you're closed, right? You can't close.
Sorry, it's
I'm sorry, you can't
Friday
close
at
the
5.
uterus.
Cross your legs. We'll see you Monday at 8.
But he did a lot, and you talk about the C-section rate and all that kind of stuff. So another
And
time
it's not that much more.
that drove me absolutely insane. This is where you can really get into the common sense of stuff, right?
Mhm.
So we'll do a C-section for nothing, just absolutely nothing. Like and they're very safe now. They used to be not safe,
Right.
but they're super safe. So there's no issue there. Then we get mom who has, bad insulin dependent diabetic, very, she was five
Mhm.
foot 0 and 300 pounds. And
Mhm.
so very unhealthy mom to begin with. And we sent her off to what they call maternal fetal medicine, which is like the specialists of OB, so
Mhm.
they could monitor her. And they actually recommended that she terminate the pregnancy.
Really?
I can't remember if there was some
Some other line.
genetic, chromosomal defect or something. There was something wrong, not just her health. I mean, something else was wrong. And she chose not to, and that's fine. And so, we went through, well, the baby had what we call a fetal demise at like 32 weeks.
Mhm.
So, she comes in for her regular checkup and there's no heartbeat.
So she has to deliver.
So she has to deliver.
Yeah.
I'm like, cut it out. Like, why are we going to put her through hours, at 32 weeks, her
Well, there's
cervix is closed. So we go through the same process that we would for an induction, right? So
right.
we're trying to, Pitocin, and we do vaginal cytotech is what it's called, where you're trying to soften the cervix up. And, I mean, this is like 3 days of her in the hospital, like with a dead baby inside her, trying to deliver this baby vaginally. So by the time it comes out, it's peeling. It's just, I mean, it was awful. And I'm over here like, we could have done a C-section on day 1, been done in less than an hour, and she recovers and everything's fine.
Well, there.
And the argument is that the risk to the mom of that surgery is too high.
Right. The thing to me about that, because I had partner that her second child died in utero. Same thing. She had to deliver
Yeah.
the baby. And all I could think of is there has to be a chemical thing that is going on. I'm sure there is. You'll probably tell me that process of what the mom is going through, what the woman is going through, of the stress, or not the stress, but like the energetic to push the baby, to go through labor and
Yeah.
delivery. And then there's that excitement, right? Of like, oh my God. And then there's that dopamine hit, right?
Mhm.
And then there's that bonding moment, but you go through all of that and then there's none of that.
Yeah.
That's
It's
got to be
awful. It's
incredibly.
absolutely awful.
I know that this former girlfriend of mine, or partner of mine, she just like, it was,
It's very traumatic.
it's unbelievably
Yeah.
traumatic.
I mean, luckily I've not experienced that personally, so I don't know, the difference between that, like a miscarriage at an early age. I mean, it's all exciting and fun, right? I mean, or exciting to be pregnant. And then, if you miscarry at 8 weeks or miscarry at 11 weeks, I mean, it's still going to be
It's painful.
traumatic.
Yeah.
But I think that would be awful.
My sister lost one at like
Mhm.
30 weeks or
Yeah.
whatever, like 28 to 30 weeks or something like that,
Yeah.
and had to deliver it.
Yep.
I just couldn't imagine. And granted, Sarah had 3 C-sections, so we never experienced the vaginal delivery, but that but that joy, like
Mhm.
even when the baby comes out, even though
Yeah, you know
freaking
it's
your
okay.
uterus is sitting over
Yeah.
here, right? Yeah. So, but the
So
baby's
there were
still on you.
definitely, the
Yeah.
downtimes for sure.
Yeah. So
Yeah.
how
It
did you
it was just
then
fun.
so I'm really curious. So when did the light bulb start to go on for you about women's hormone health?
Yeah.
When did that so you're in this space in 2006. When did this start to kind
Yeah.
of kick in?
So, I mean, I did it because I loved obstetrics, right? And then it was like, okay, by the way, when you're not delivering babies, you have GYN day.
Mm.
And so GYN day for me was all pap smears and,
Nothing better than boy, nothing
annual
passes a day like
exams,
20 pap smears.
lots of annual exams, and then an occasional. I mean, I didn't get the complicated GYN stuff that needed surgery.
Right.
Those went to the surgeons, but I got the teenagers, the irregular bleeding, that kind of stuff. The menopausal women either on hormones, and I'm like, you need to come off. So this is
How many
Women's Health Initiative, right?
How many times did you have that
Oh,
conversation? Do you ever want to call them all
which
up and
was
just be like,
wrong.
"Say I'm sorry"?
Well, it was right in that Premarin was causing a lot of problems, and so we definitely want to get people off Premarin and Prem Pro, but the whole just all hormones are bad thing was a little over the top for sure. So the Women's Health Initiative was like in 2000, 2002, somewhere in there.
Mhm.
So I was in medical school at the time. And so, I remember being in some auditorium where this announcement came out.
And
This
tell
big
everybody,
deal.
tell everybody what the Women's
Okay,
Health
so the
Initiative
Women's
is.
Health Initiative basically was a study that the Women's Health Initiative was doing with regards to women's health and hormone replacement.
Mhm.
And they were studying Premarin and Prempro, which Premarin stands for pregnant mare's urine. And so it was the hormone replacement we were using at the time that went way back into like the 1950s was when Premarin first was introduced as hormone replacement. And it's funny if you go back to the history of like the marketing of that and how they got away with like being patented forever and ever and never went generic. And I mean, it was
Mhm.
very political and money involved and
All of
stuff
it
like
is,
that.
yeah.
And maybe that's why the Women's Health Initiative was studying them. I don't know. But anyway, um, so what happened is they actually stopped the study earlier than the planned. I think it was supposed to be 7 to 10 years, and they stopped at like 3 to 4 years because what they were finding is that the in their research of women that had been on Premarin or Prem happened, 2002. Basically, I was in medical school, and so Women's Health Initiative was studying Premarin, which is pregnant mare's urine, which is
Mhm.
what we were using for hormone replacement, basically. And there's some really interesting marketing. Like there's articles that show, like, if your woman's having menopause, like, we have the cure for it or something like that. It was all
Right.
directed to men
Right.
because women were at home. They're papers
Women
and
weren't making medical
magazines.
decisions.
Yeah,
It's like the
yeah.
man's like, "Why don't you go do this, honey? You're being a bitch."
And, no, like my grandma was 89 when she passed away several years ago, 10 years ago now, but she was on Premarin for a long time and they said it was just for her bones. So for years and years, we were putting women on it without symptoms just for
My mom was on it.
bone
I
protection.
remember my mom being on it.
Which makes total sense.
Yeah.
That was the one good thing that Premarin did have. So in the positives, it was decreasing the risk of osteoporosis and decreasing, fractures, but then it was doing all these bad things with heart disease, stroke, and breast
Mhm.
cancer. Women were dying. And so the Women's Health Initiative came out and said, this should be stopped. Like, you need to take women off of it. ACOG, which is American College of Obstetrics and Gynecology, says, use the lowest dose possible for the shortest period of time to get women through the menopause.
Get through. Yeah.
So, 2 years, maybe, some flashes like,
Because it just,
if you put them on it and you take them off of it, then they're just going through menopause again. Like you
yeah,
gotta
you're just delaying it by
wean
2
them
years.
off. You got to do something, right? And so nobody was really looking deeper outside of that one statement that, okay, Premarin is helping with osteoporosis, but they weren't really looking at any other, sort of benefits. And it's like when you start, I'll go back in a second to, when I started really looking at hormones differently. But now, like literally, what's today? Thursday. On Sunday, I'm presenting. We're both presenting at the same.
We're both going to be in
conference.
Dallas. Are you on the 5?
I get to go. I get to go before you.
Okay. Good. Warm them up.
We're so I'm presenting actually on the chronic diseases associated with hormone decline.
Mhm.
And so, this is not just about I'm having a hot flash symptom or I'm having, vaginal dryness or, I'm emotionally crazy when I went through menopause or whatever the case is, but literally talking about as hormones go away, the risk of bad things happening goes way up. And it's
Mhm.
like at age 50, what do we tell everybody? I'm in family practice, so we're all about preventative health. So our
Right.
job when you turn 50 is to say, have you had your colonoscopy? Have you had your mammograms yet? Are you getting, whatever the
Right.
screening that was supposed to happen at age 50, right? Well, what happens at age 50? That's when our hormones go away. Like for both men and women, really, at or around age 50
Yeah.
is when menopause and andropause happens for men. And so nobody's putting two and two together that like these risks are going up because our hormones are going away and we're not
Mhm.
doing anything about it. So it was driven for a long time as just symptom
Right.
control. So if we can't
No
hormones, we'll just give
correlation
you
between the fact that my hormones are dropping and my health risk
correct.
is yeah.
My cholesterol goes up.
Yeah.
Okay, here's where we can get fun.
And
So
I've experienced that. Keep going.
and here, this is what I think is the funniest thing. So I'm in college and you have to take biochemistry for, if you're going to go to med school, you got to take biochemistry. So I got a C in biochem 1 and biochem 2 in college. And like, that was devastating because, I'm trying to get into med school and like getting a C on your report card is the worst thing ever.
Should have seen mine. Anyway.
Whatever. I survived. And then go to med school, got a C in biochemistry. And then every day, all day long, all I'm doing is biochemistry. Like, because hormones are all biochemistry. And
Mhm.
like, not everybody might picture that and see that. But like, when I didn't have something practical to put it into, I couldn't do it. I'm over here like, I don't know what these letters and sticks and all this stuff is. But now I picture it, I've got the steroid hormone cascade on my screen in my office, and
Mhm.
I'm explaining this to patients all the time. And so at the top of this hormone cascade is cholesterol. And then it goes into two places. It goes into progesterone and it goes into DHEA,
Mhm.
which then filters into estrogen and testosterone. And then
Mhm.
progesterone and cortisol are on the same side over here.
Mhm.
So what's fascinating is that as your hormones start to go away, your body goes, hey, those were really cool. Can we have some of those back? And so it sends signals to make more. So what does it need to do? It needs to increase your cholesterol. So we're getting high cholesterol not because, you could get high cholesterol because your lifestyle sucks and you're eating McDonald's and pizza, but you could also start getting high cholesterol around age 50, 45, somewhere in there because your hormones are going away and your body's going, those were protecting us. We should
Mhm.
make more. And then the signal, because we don't then have the signals from our ovaries or testes to turn that cholesterol into actual hormones, it just stays up there for a while. So
Yep.
we now have high cholesterol. So we can actually treat high cholesterol by putting people on bioidentical hormone replacement. I see it all the time. In men, it is
It's
perfect and beautiful. Women are a little bit more complicated.
no shit. Really?
Really?
Yeah.
Yeah.
Geez. Newsflash. Well, I'll tell you a funny, interesting story about
Yeah.
that. So I was 42, 43, and we had survived the Great Recession, and Sarah got a job working in the hospital. So we had healthcare, right? So I'm like, well, I'm going to go get my annual physical, right? And I go get my annual physical, and they do the blood work and everything, and it comes back, and I'm 43 years old, and I have high triglycerides and high cholesterol. I can't remember the number, but maybe my cholesterol was 225.
Yeah.
My tris has always been, starting in my 40s, have always been historically high. And so, of course, he wants to put me on a statin, and I'm like, I don't want to do a statin. I just didn't want to. I didn't know statins were horrible at
Right.
that time. This was whatever, 90,
You
2000.
had some intuition. I don't
10,
wanna be
just
on
intuition.
drugs.
I'm like, this
Yeah.
doesn't make sense. Kills rats. So he's like, go eat low fat. So of course I eat low fat, which then makes the number go up even higher.
Right.
Right.
Because you're eating high carb.
Because I'm eating high carb. Duh. So anyway, then I wind up owning the clinics. Okay. And he puts me on a statin. So I'm like 45. Right. And I'm going to the gym. I'm like, my legs hurt and all this stuff. So then I own the clinics, 47. We decide we're going to start offering testosterone therapy, HRT. Clinic have been open 6 months. I'm patient zero. We do my blood panel. My cholesterol's like, I swear to God, my cholesterol's like 3 something stupid like
Yeah.
that. My triglycerides like 4 something, and my testosterone level is 92.
Yeah.
And my DHEA is like no vitamin D. Like
Nothing.
my vitamin
Yeah.
D is like non-existent, and my DHEA is like Both of all non-existent. And this was back in the
Things
day.
that regular doctors don't look
right.
for.
Oh, and this was 2014. So
Right.
like back then HRT was like, take some DHEA and do like a shot once a week kind of thing.
Yeah.
Right. So, and, take some, pregnenolone, I think.
Mm-hmm.
And anyway, I start testosterone and DHEA and vitamin D. I come back and get my blood work done 4 weeks later. My testosterone level's 750. My cholesterol's 215.
Yep.
My triglycerides or whatever, it was like 190, whatever the number was.
Yeah.
It was a significant drop.
Way better.
And all I did was vitamin D, DHEA, and testosterone. And I start reading the literature then. So I'm not anywhere near where I am today, like in understanding all this.
Yeah.
And so I start reading the literature. I'm like, son of a bitch, DHEA is like the magic, it's like the magic drug to a certain degree.
The cock that fills in the cracks.
Yeah,
right?
I called it this sticky, I wrote marketing pieces around it because this is back in the day when like, oh, testosterone's bad, men shouldn't do it. That's just the natural progression. I'm like, if you got a 67 Mustang and it needs a new carburetor, you're going to get a new carburetor in it? Like, come on, let's do this. So I start writing marketing pieces about it. And what I did was I called DHEA is the magic elixir. And what it does is it makes the cells sticky so it can receive the testosterone that is floating in your body. Now, I know that's not 100% medically correct, right?
They all work together, though.
But that thing right there, guys, went, okay, that makes sense, right? And we saw the same thing because we would do their lipid profiles and we saw it's just, does it piss you off?
Yes.
How badly
this is when I say I'm embarrassed to be a doctor because it's just like common, I mean, some of this stuff is just common sense.
Well, you know what Mark Twain said, the problem with common sense is it's just not that common.
Yeah.
So anyway, I interrupted you. What you say? It's common sense.
You just start thinking about, like in hormones, it's like, okay, we can talk about bioidentical in just a second. It was like bioidentical, you can't control that, it's not so we're just going to put somebody on this for the shortest period of time. Like well-known things that we know cause harm to people, but we're okay with saying yes to that, but saying no to this, that, also has plenty of studies that say it's actually way better. So, so let's go backwards for a second. So 2008, so I've been in this practice 2 years, trying to deliver all these babies and do whatever kind of women's health I can make up at the time. I had partners down the road and down the hallway, I go ask them, what do we do? I remember having drug reps come for lunch. I mean, this is back when they brought really good food.
Yeah.
And we had lunch and we would have our sample closet. And it's just like Eva Mist. Do you ever remember Eva Mist was this?
What was Eva Mist?
Pump, estrogen replacement pump. So we started getting all this on right here on your arm. So it was like,
wait, you would have a pump right here in your arm?
Well, not a pump. Like it was like a little device where you would stick it on and you would push the button and it would dump, an appropriate amount of estradiol. And so when the Women's Health Initiative came out, of course the Previn reps coming and like, it still helps with osteoporosis. They're just dying. Nobody wants to use it anymore. But, all these other reps then are coming out with all the healthy ways to, use hormone replacement. And so Eva Mist came out and it's still dosed, like androgel for men is dosed like way high. And Eva Mist is dosed, probably 4 or 5 times higher than what actual estradiol.
Because they just want you to get like a bump and then you have a decline, then you peak the palate.
Well, they're also,
mountains
this is where we can get into the science. If you're putting topical hormones on, you can't really measure them in the bloodstream because they don't show up. Like they're going into your blood. I mean, they're going into your skin. They're going to go where they need to go. And then they don't show up in your veins, which is the leftover blood after it's already gone somewhere. And so they're dosing based on blood levels, and so you have to get the dose really, really high in order to actually see it kick up in the blood. So like testosterone in men, if you're doing injections, it's fine because it's going, you're going to measure it in the bloodstream. But if you're doing anything topical, you have to measure it either in saliva or urine. So blood testing for topical hormones is not accurate.
Okay.
So you're going to way overdose somebody.
Okay.
So that's what I was seeing. Well, I didn't know it at the time until I started figuring it out and learning. So 2008, I call this divine intervention of whatever sort, universe, whoever.
Who's ever calling the shots?
So my sister, my half-sister, I guess you call it, was in San Diego at the time. And she was getting married in October of 2008. And I happened upon one of those this is way back when we actually had magazines that we read.
Mm.
And there was an article for this conference. It was called Practical CME, and it was a GYN. Interestingly, lives about an hour and a half from me, but we met in San Diego. And he was a GYN who was teaching about bioidentical hormones and hormone replacement. So he had a conference in San Diego the same weekend that my sister was getting married in San Diego. And so I said, perfect timing. I'm going to go to this conference. I think it was Wednesday, Thursday, Friday, something like that. I missed whatever day was happening on Saturday to go to this wedding. And that was on natural hormone balancing, natural weight loss solutions. That's back when HCG was very popular.
Yes,
So I learned all about HCG.
It's good stuff.
Came home, put everybody on HCG diets.
It's
And
great stuff.
So that was my first introduction to saliva testing for hormones, adrenal, looking at thyroid in a different way than just TSH. Like, I had never been taught any of that stuff. Like, the only conversation I remember having about anything to do with adrenal was something about Addison's, like in medical school. Like, I had personally never seen a patient with any, severe either Cushing's or Addison's disease or something like that, which is like textbook adrenal dysfunction.
Right.
But I had never heard about testing for cortisol levels, actually measuring hormones, and I remember kind of asking, like, why don't we measure hormones? Well, we're just going to put them on birth control or whatever. Like, you don't really have to measure them. You just go by their symptoms. Like, you just put them on something, and if they're good, fine. If not, increase the dose. Like, that was literally the brain. One of the guys that taught me how to do hormone pellets. So I did pellets for a while in my practice. In the OBGYN office, we were doing pellets. And I mean, it was like, we didn't even measure blood level. It was just like, did one work for you? How long did it take?
Really? So you would
Oh my gosh, that's how I was taught.
Oh my God.
So
you weren't measuring it all. You're like, let's start with 2 pellets and see how it goes.
Give them one. So the first one was give them one. This was estradiol. Give them one. And literally he would be like, if they come back around 3 to 4 months, wait for them to make their appointment. If they come back around 3 to 4 months, one was good. If they call it 2 months, then one was not enough and they need 2. If they go all the way to 6 months, they can decide, do they want them to last for 6 months, or do you want to decrease the dose to get them into the, 3 to 4 month cycle? That was the conversation. That's how I was trained to hormone replacement when I was in residency.
Okay. So do you ever just like, so we're driving to the airport today, right? We're driving from LA to the Santa Monica airport, flying here today. And I was like, where does the phrase blow smoke up your ass come from? Okay. So of course I've got to go to Perplexity and look it up, right? So it comes from England in the 1700s and the 1800s. And people would apparently fall into the Thames River and drown all the time, right? And so what they would do is they had all these things along the Thames, and they were these cones with tobacco. And what you would do is you would light the tobacco and you would blow smoke up people's ass. And the thought was the nicotine would revive them. This was a practice that went on for like 100 years.
Somebody that's already dead, and they would try to.
Yeah. Now you think after like 100 times it not working, you think you would have been like, maybe this isn't a good idea. Like, I just get cracked up at the things even today. Like, let's just put one in and see how it goes.
Yeah.
Like the shit that we come up with about how we're gonna let's just. It's such bullshit. It's like leeches. Let's bloodlet them. We'll get better.
See what happens.
Yeah. Kill the president of the United States that way.
There was literally, I mean, and hormone replacement was like, this is the algorithm was, do you have a uterus? Yes or no? So if you have a uterus, then you should get estrogen and progesterone, which was really a progestins, which is the opposite of progesterone. We can get into that science. Or if you don't have a uterus anymore, then you just need estrogen and nothing else. And then really,
so they would just say, just give the guy
testosterone.
Testosterone. Just give the guy estrogen.
No, this is for women.
Oh, for women if they don't, if they'd had them. Okay, I'm sorry.
I was in the GYN world.
I'm sorry. Men. You got to remember. You got to leave. You got to leave breadcrumbs for me.
Clinic on Friday afternoons. We close the office on Fridays. In the OBGYN office, I had man clinic because I started seeing men for hormone replacement because I was doing hormone replacement on all these women, and they'd be like, "Do you do this for men too?" Or the HCG, I was doing, a lot of weight loss.
Yeah, HCG was great.
And then, people were sending in their husbands to get HCG or to get hormone replacement. And so I'd opened up man clinic on Friday afternoons in the OBGYN office. So Anyway, no, this is women's health. And so it was uterus, yes or no, meaning
Yeah.
they had
I
a
just had to make sure I was
hysterectomy.
clear. I'm like,
That's why they had Premarin and then they had Prem Pro. And so Prem Pro is the one that, technically, so here's the theory behind this, is that you need this progesterone to protect the uterine lining from overstimulation of estrogen so the estrogen doesn't cause endometrial cancer.
okay.
So what happened is that it was doing that job. So the progestin, which is a synthetic progesterone that we were getting, sits in the receptor but doesn't allow regular progesterone to get in. And so it's basically blocking all the good progesterone receptors. It's also blocking estrogen. So it's doing its job by not causing endometrial cancer.
Mhm.
But by the way, this is the study that showed increased risk of strokes and breast cancer.
Right. Right.
So it's not protecting the breast tissue from the overestrogen, and it's not protecting the cardiovascular system. Progesterone is fabulous. It's anti-inflammatory. It does all kinds of good
Mhm.
stuff for your brain, for your heart, your skin, your hair, your mood, your sleep. I mean, it's just the magic hormone, really. And so, we were depriving women basically of that because we were giving them anti-progesterone basically when we were doing that. And so, that's kind of the theory is, do you have a uterus? Yes or no? And
Right.
so this is the drug
Right.
I'm going to
Right.
choose. We don't need to test for anything because we could test you, but your hormones are going to be low. If you're menopausal, what's the point of testing? And it was completely just driven by symptom control and nothing else. So, then you would say, well, hormones are good for your bones, so you should just be on it whether you have symptoms or not. So what was happening is I was seeing a lot of women that were having like what we might consider non-traditional hormone symptoms. So a lot of sleep issues, a lot
Mhm.
of fatigue,
Mhm.
weight gain, depression, mood type stuff, that sort of thing. And so these Band-Aids for, sleep aids and antidepressants weren't working. That's what happened is like women were going to the nut house when they went,
Right.
when they went
Right.
menopausal back in the 50s, 60s, whatever. It was just, you know, your mom went crazy. Like there was no,
I remember.
you know, and they didn't have antidepressants back then, so they really didn't have a whole lot of good support for these symptoms. So literally, like in the OBGYN world, I make fun of it now, but it's like our two drugs were birth control and antidepressants.
What
Maybe
a
a sleep
combination.
aid. Yeah. Then it was Nuvigil came out, or Provigil. So if somebody was tired, that those were
Yep.
drugs for narcolepsy,
Yeah.
but they started being used, they're amphetamines. And so they started being used for just to help people with energy and to get through the day. This is kind of before ADD and Adderall kind of came out as adults.
Right.
In kids, we were using Focalin and ADD and whatever all the time, but not in adults. We just used Nuvigil, which was the same thing.
So
we're
when
just
did you
drugging
okay,
people
so
up.
when you
Yeah.
were just so you're just kind of making this shit up.
Yeah.
Like so
Yeah.
when did you start to be
There's
like,
no rhyme or reason. So
maybe we should do like a urine test, maybe we should do a
yeah.
blood test. When did that start to kick in?
So this was October of 2008.
Yep.
I go to this conference and I was introduced to saliva testing. And I literally talk about this all the time. I'm like, it felt like this Alice in Wonderland experience of going through this tiny little hole into this like entire world of, I don't know, like I just picture the jungle, blues and reds and I don't know, like just gorgeous
And you didn't even take psychedelics and you got
place.
all
No,
that. Yeah, that's
it was
great.
just that's my description, this visual of like this aha moment of like, wait, like we could actually see what's going on with people. And so, I come back and I remember a patient, Teresa, her name. I had given her everything under the sun. And so I sat down with her. I said, hey, I just learned this new thing. Like, bear with me, but will you do this test? You take it home, you collect these samples. And so, people that are starting now, we teach a lot in BHRT training academy, whatever. And they're like, I still feel like I don't know what to do. I said, I called that lab every day for 9 months. Like if I did a test on somebody, I called the lab and said, here's my patient, here's their lab, what do I do? Right? Like I didn't have BHRT training
Mhm.
academy. I didn't have anything. Sometimes I might have emailed the guy that was there. But that's I self-taught basically because the lab taught me, but like I did a test and then I called and said,
Right.
how do I
What
do
were the
this?
numbers? Yeah.
And I remember using one lab. There were a couple different labs that were doing this at the time. And one lab, what would happen is that the doctors that worked for them, I think they were just spread out all over the place. And so they were very inconsistent in their responses. they were all different in what they were saying. And, some of them could prescribe. And so they would tell me the prescription, but some of them were like naturopaths or, some, not that naturopaths are bad, but like they were in a place where they couldn't prescribe. So then
Right.
they're giving me all these supplements to try. And so I was just like all over the place. And then I started, again, kind of not really scientifically beta testing, but then I would do a different lab
Right.
to see what was going on. And when I called this lab, they were very consistent, like it wasn't cookie cutter necessarily, but it was like they had a protocol. And they said, when this, do this, right? When this, do this, like it, and it just kind of, it fit my brain. I could visually see what they were talking about. And so then they had a conference probably that following spring. And I ended up going to that one. I think they called it Advanced Hormone Workshop or something like that. And so I ended up going to that one for Labrix was the name of that company. They're now bought out by Doctors Data. And I went to that conference. I mean, if they had a conference, I was there. I mean, I was like,
Yeah, that's the way you are
stuck.
too. Once you get something, you you consume it.
And they started doing like neurotransmitter testing, and then they would talk about gut health and all this stuff. And so I got to the point where I went to their conference so many times that they invited me to speak because I was like, their
Sounds
highest,
familiar. I see the pattern.
the highest customer. Yeah. I mean, I was like, everybody used to be little brown boxes. And so I said, nobody walks out of my office without a brown box. I mean, I'm just like, everybody needs a saliva test. Like you can't function without like everything revolved around.
And this
what
is
were your
2008 up
hormones?
to like
Yeah,
9, 10.
Yeah. So I'm doing this in the OB office and they were receptive to it. Like they would send, even my partners were like, hey, I did this saliva test on my patient, can we look at it together and whatever. So like they were picking up on what I was doing.
Was all this covered by insurance back then?
Yes.
Oh God.
So we could bill saliva tests because, well, until the insurance figured out. So what happened is that the code for an assay for estradiol, it didn't matter whether it was saliva or blood. They didn't know. I mean, it's just one code that says what's the level of estradiol. So what happened though is that when we started charging for 4 cortisols, because when we measure adrenal function, we measure 4 cortisols a day. And then the insurance would go, why are you doing this 4 times? Is that a typo? Is that an error? We need to know why. Then they had to say, oh, well, that's a saliva test. And they go, oh, well, we don't cover saliva testing. And so then it was like, you didn't even know it was saliva test until we told you. So that took a few years for them to kind of figure things out a little bit. But when I opened my practice in 2011, so this was 2008 when I started doing this, I was, doing a lot of hormone stuff, delivering babies, living the dream. Then the OBGYN office brought in a consultant to evaluate the practice and just say where are we? We need some help with our numbers and whatnot. And the consultant was also there to help value whether the hospital could come buy out the practice or not.
Got it.
And I didn't really know that when they first came in, but, it wasn't a secret or anything, but I realized, later when they came in, they said, okay, well, here's where we're seeing where, your accounts receivable is whatever
Whatever
percent,
it
I
is,
don't know. All these numbers I didn't really care about at the time. Like I didn't know anything about the business of medicine back then. And so, they were like, I think it makes sense for you to get bought out by the hospital. So the partner, the main partner was responsible for that. And so he's like, I think this is what we're going to do. And that consultant, I worked a lot with him because we were, in the office together for whatever couple weeks that he was there. And we went out for Mexican that night and he said, I think, and I was just like, I'm not doing that. Like
I'm not going to go work for the hospital.
I'm not working for the hospital. I don't know where they're going to put me. I'm family practice in OBG. Like, are they going to put me in the family practice place? Are they going to even keep me? Like, I don't know. That was not my thing. And I was doing all this alternative stuff at this point. So 3 years I've been doing saliva tests and, now we have supplements in the office for DHEA and adrenals and gut health stuff. I'm doing stool testing now, things like that. So this is like me dabbling in functional medicine stuff. And so I've got literally a shelf in my office with supplements that I'm buying with my own credit card and, selling them to patients. Because this office didn't have any money. So we didn't have a credit card that I could buy. I mean, the OBGYN office is going downhill anyway, which is why they're going to get bought out by the hospital system. And so, he said, "Well, you can do it. Like, why don't you open your own practice?" And I was like, "Are you kidding? Like, I
So
don't know
were you
anything
still
about
in
this."
Anderson then? Were you still
This
in
is in
Anderson?
Seneca.
In Seneca. Okay. 7 miles south of where you are now.
Yeah. So that was just this crazy idea. And I was just like, how do I even do that? And he says, well, you hire me. So it was $25,000 to hire him
To
to
get accredited.
open my practice. He had the checklist of here's all the things you do if you're going to start up your practice. So we started looking for locations and he did it all. I mean, I didn't do
Yeah.
anything, but I had a business plan. I went to Wells Fargo, got a $300,000 loan, announced to my partner that this is what my plan is. I'm not going to be bought up by the hospital. I'm going to open my own practice. And it was amicable. I mean, like,
Yeah.
he didn't care,
How'd
I
it
mean,
go?
he cared, but like,
Right. He was
fine,
done.
whatever. So that was, my practice going to open October of 2011. And my plan was that it was a 5-day work week. So I was like, I'm going to work 1 day a week, in my practice over here and keep working for you and call for month 1. Month 2, I'm going to do 2 and 2. And then month 3, I'm going to be 1 day a week here and
Right.
3 days a week in my practice. I guess it was 4 days. And that was the plan. And so
How'd
I
it go?
said, go, we're going to open everything up. And
What was the scariest thing for you once you opened the practice? Like, there's the honeymoon stage, right? Like, I have my own place. This is great. I write
yeah,
my own paycheck. And then, like, week 6, like, there's no money in the bank. Like, what?
yeah. I mean, it was definitely because here's the scariest, well, scary part is that
Yeah.
my husband at the time was my office manager. Don't do that, number 1. I mean, there are
Don't.
couples that work well together. That did not work for
It's
us.
rare.
But, he was actually a stay-at-home dad. So by this point, we have 4 babies. Baby number 4 was 1 years old. So she was born in 2009. So in 2010, when I'm having this conversation about I'm gonna think about opening this practice, or, she's 1.5 years old while I'm doing this, like, because I have nothing better to do, right? Like,
Yeah.
baby
The
number
oldest is what,
4.
8 or something like that?
Yeah.
Yeah.
So,
And you were insurance with a little bit of cash?
no cash at all.
No
So this
cash
is
at all. All insurance, everything being covered by
literally family practice with hormones on the side.
Okay. When did the hormones become like the primary thing?
I mean, it was the primary thing. I mean, I
Okay.
opened, the name was Carolina Integrative Medicine. Like, I'm doing integrative stuff with hormones, whatever. But I'm primary care. I'm doing all the sick visits. I'm doing all the annual exams. Still, and then I thought I'll still deliver babies too. So I added that onto my malpractice on top of that, thinking I could still do this. So I had like 8 patients.
God, you were making all the classic mistakes, right? Well, I'll do this just in case because I can make a little bit of money and I'll help.
Well, no, I just wanted to deliver babies.
Oh, okay.
So that turned into a problem with my marriage because it was, my job at the OBGYN office to be on call and deliver babies. Once I opened my own practice, that was fun and that was volunteer. Like, I didn't have to deliver babies, I just wanted to, but yet I still had to be on call. So the agreement or the arrangement that I made with the family practice residency program that I left was that I would take call with them. So I left the OBGYN office, shut burned bridges there, because this, we can just keep going on forever. Like, how much time do we have?
No, I mean, so yeah.
Anyway,
So yeah,
so I opened my own practice. I had this whole plan for like 3-4 months. This is how my exit strategy to kind of support, I still needed a paycheck from the OBGYN office until my practice gets up and running. And so that, that was the verbal agreement that I had with my partner, who was the owner of the OBGYN office. So when I went to the lawyer and I had this written up and I said, okay, so we need a decision about how I'm going to get paid. Do you want to pay me by the day? Do you want to pay me by, patient revenue? However. And so, I went to the lawyer, I went to our accountant that we used and said, tell me how we would divide this up. And so I had paperwork ready to go. I just need you to sign this because it's time to, time for me to go. And he wouldn't sign it. I want to talk to the accountant. I want to talk to the lawyer. I want to do, I want to look at it again. So 2 weeks went by. I'm like, okay, it's time. Did you look at it? Did you look at it? No, I'm not sure that this is fair. Whatever. And so
you just went cold turkey?
Friday afternoon, I went and got all my shit and I said, I'm done. And so I had to call the hospital, I'm no longer on call for OBGYN. I left and he had different story about how I
Yeah, no
abandoned and
shit.
whatever. And, so I had to have lunch with the other partner because she was pissed off at me because now, she's having to do every other day call
Right.
instead of every 3 because I'm like, I'm not taking call for you guys. I'm out. Like,
If you're not gonna pay me, I'm not
if you're
gonna.
not going to pay me, yeah, I can't do this. So he did not follow up with our original agreement. So that was scary because I just,
So all you're
Friday
doing
I
this
was
cold
done.
turkey. Your husband's a stay-at-home dad. You got 4 kids, ages 8 to 1 or whatever,
Yep.
and now you've got no paycheck.
Yep. $300,000 loan, which you
$300,000 loan.
can't pay yourself with that. I mean, there's significant rules about like I
Yeah,
didn't know
yeah,
anything, right? You have to
yeah.
go like ask the bank for I need money for this and I need
Right,
money for that. And you had to, it wasn't like you just got $300
Res.
given to you. You got $300 line of credit basically, and you had to ask for
When did you make the
payouts.
full move and completely get rid of all insurance and just go full cash?
That was 2021, 2020,
You did it for the
10
better part
years.
of 10 years.
Mhm.
And did you try to do hybrid?
A little bit. So then I learned 2017, one of the drug reps actually from Zymogen kept telling me, he's like, you need to do like these wellness programs. There's people out there doing these things. Like you probably know Michael from Zymogen.
Oh, yeah,
From
yeah, yeah,
He
yeah.
lives in
Yeah.
Charlotte.
Yep.
So he's been telling me, and I'm like, I don't know what that is. I'm just like in my own bubble of like crazy, and I don't have time to do anything else, right? And he's like, they take you to Texas and they tell you everything about it. Like you should just go to Texas and check it out, right? And like he just kept telling me about it because all these Charlotte doctors
Hmm?
were doing it.
Was
And
Deb doing it then too?
yep.
Yeah.
So she's probably 2 years ahead of me.
Okay.
And so, finally I went. And so basically it was another eye-opening experience of packaging your services. You didn't exist at the time. And so it was, sort of coming to what I was already doing, trying to piecemeal it with, visits every 6 weeks. And I was always behind because I have so much to talk about. I couldn't
Right.
do a 20-minute visit.
Right.
And so I'd be 45
And you're still trying to get all this
minutes,
paid for by
all
insurance.
trying to pay by insurance. You get, $38 for whatever. I had
Five.
2 practitioners at the time. I had 13 employees. I had 3 people at the front desk just answering the phones. We had 3,000
Jesus.
patients. So, it was,
God.
from that, it looked very
The
successful.
perspective, but little did they know you're like
We weren't paying
sweating.
ourselves. Yeah, sweat and payroll, paying, using this credit card to pay this credit card to move this stuff around. It was awful. So then from that OBGYN office, what I didn't know, so he never got bought out by the hospital system. 18 months after I left, he shut the doors
Wow.
and just moved to Kentucky or, took one of the OBGYN recruiting jobs in Kentucky. So while I was there as a partner, we got a loan for the practice. So when he shut the business down, when the building went into foreclosure, there were multiple loans throughout the history of that practice. So when the building went in foreclosure, they got, pennies on the dollar for it, went through and paid the oldest loan off 1st. And the
Mhm.
loan that we had left had $109,000. They came after me for it. I'm like, I don't have $109,000. Where are you going to find that? We had a personal guarantee on that loan. He's in Kentucky. They don't come after him. So they're coming
Wow.
after me. I get a lawyer. What am I supposed to do? They're like, you don't have any assets. Like they can't do anything, you know? Well, they hire a forensic attorney, start going through our credit card records. And so this is the biggest mistake you can make in your business is to mix your business credit cards and your personal credit cards because we did it. I didn't know we were doing it, but my really smart office manager husband was just using whatever credit card that
Yep.
we had money for to pay the bills and to pay whatever. And so they said, if you're doing this, then now we have availability or ability to have access to your office records because you were using your office for your personal card. And we looked at your personal stuff, which means now we have an avenue to look at your office stuff. And they decided that the office was profitable enough that I had to pay $109,000 in 2 weeks. So we went to court and they said, you owe this money and you owe it in 2 weeks. And my lawyer at the time said you could file for bankruptcy. And I was like, I don't know what that is. That's scary.
Right.
I'm not doing that. I go get some stupid ass loan for 35 or whatever.
Mafia money.
I could get it in 10 days. You could have the money in the bank in whatever days. That sounded amazing and fun. And so I got this huge loan to pay off the $109,000 lawsuit, basically. And, I mean, we barely met. That was 2018, 2019. We hardly, we couldn't function after that.
Yeah.
Like, we were
No.
so far in debt.
Yeah.
So every amount, I mean, we had 3,000 patients, we're billing insurance, money's coming in and it's just going out, like crazy. And
So was this the impetus then to say, we got to get out of the insurance system?
somewhat, so all this is happening and it's 2000, whatever time, 17, 18, somewhere in
yeah.
there. So I was doing wellness programs, but I was trying to hybrid. So I was like, we still have insurance going on.
Hybrid
We
is
still
just
have,
a nightmare.
this, but then we have these wellness programs. And so I started doing talks in the office, bringing in our current patients. And so my first 4 programs were our own patients who were like, yes, I'll do this. And
What do you remember what you were
paid
charging?
$3,000,
$3,000.
3,
Probably
5, something
barely
like
covering
that.
all your costs.
If you did an individual program, it was $7,000 if you worked just with me and not with the health coach or whatever. I don't even know what it was. Only one patient paid that once.
Yeah, but that's statistically what would happen. But
Yeah.
that's good.
So, then
And so-
COVID hit.
Oh God.
So 2019, back to, so I'm in this coaching program, we're doing wellness programs, whatever. And I'm like, I need help. Like I'm doing these programs, but I'm not doing enough. I can't afford the marketing that you're recommending for us to
Right.
go get dinner talks. We had to go spend ads and do, pay $1,000 a week to do a dinner talk. That was their recommendation.
Yep.
And I'm like, I don't have the money to do that. Like I've got to do something else. And then so finally I'm just crying to the coach. I'm crying to this crying all the time. And, middle of going through a divorce at the same time, got divorced in 2018. So kicked him out. We bought a 9-round gym so that he would just have something to go do. So we spent another, probably $40,000 of our own money to buy a 9-round gym so he could go do that.
Go do that.
And
Yep.
then get out of the business. And so finally, the financial guy from this coaching company sat down with me and looked at my numbers. This was in like October, November of 2019. And he just said, I don't think there's any way for you to get out of this. Like you have to file for bankruptcy. So when, December of 2019, found the bankruptcy lawyer, started the whole process and filed March 6th of 2020, signed the papers for bankruptcy. And, at the time.
Do you find that freeing?
Yes. Oh, 100%.
When I signed my paperwork in
God.
2010, phone stopped ringing. Like my cortisol levels dropped through. It was like, what a relief.
All that debt away, all the bills went away, but, and I think what I resisted for so long is that I thought I was going to have to announce it to the world. I thought I would have to shut my business down. I didn't know, like, I thought it was going to
You
be
did chapter 7?
Yeah.
Yeah.
But I didn't know the difference between, before I was educated about it, I really thought that was the end of it. You had to shut your business down. So I finally go to the lawyer. He gives me an explanation. He's like, no, all it is just refinancing, basically. You keep your business name. You keep doing business as normal. Everything's normal. We just take all these loans and go ask them, what would they take instead? And so we had to have some negotiation, obviously, and stuff like that. But yeah, I mean, I went from whatever I was paying in debt. I don't even know what that number is, to like $3,600 a month was what I was paying off on.
Yeah. And you were never making up any,
these
it was all
loans.
interest. Yeah.
And the only one that was a secured was the Wells Fargo loan. So I had to finish paying that off, which was fine. I mean, that's the one I got for the practice to begin with. So yeah, filed for bankruptcy 2020, March of 2020, and then COVID hit March of 2020. So.
And then we met when? Was it 21
October.
or 22? Was it October of 20?
No, I think it was 21.
It was 21. It was October
we were
21.
not in COVID anymore.
Yeah. Well, North Carolina, South Carolina, we weren't in COVID. California, New York, they still were.
Yeah.
The South
was
were
well
like
beyond that. We were not, because
South Carolina,
20,
yeah,
there were still like we weren't gathering in groups.
No.
Even back then.
You remember? I lived on the North Carolina, South Carolina border, and so Charlotte was draconian, like shut down, stay in your house, like we're all gonna die. And you drive like 3 miles south, like all the gyms are open, people are like hanging out at the park drinking.
We're Georgia, South Carolina, so we drive to Georgia just so we could go out to eat.
Yeah.
Because they were open in Georgia, but not in South Carolina. So
it was hilarious. So
that, COVID was crazy. I mean, for everybody, but I mean, we were.
So by that time, so we meet in 21. You're all cash at the time? Or you still do a little insurance?
So 2019, I should go backwards. 2019, January of 2019 is when we sent the letter to 3,000 patients saying by May 1st, you need to be, in a membership. So we were doing the membership thing. And that was probably worse than the bankruptcy, I would say, from a stress perspective. So that's why I always tell people, rip the Band-Aid off, just get it over with.
How many people of the 3,000 joined? Do you remember?
150,
Yeah.
174, like less than the 10% that they said that
It's
you
a
would
great
get.
pitch, by the way. It's a great, so I've got one of these days I'm going to do a podcast on this topic, a solo podcast of the math never works in the membership model.
Yeah.
Because it's a great pitch. All you need is 200 people paying you $200 a month. It's $40,000 a month. Who can't cover all their bills in 40? You deal with all the patients on the phone. You have like 2 staff members. The problem is you never get to the 200.
Yeah.
Because there's always a 3 to 5% churn every single month from non-payments, people dying, they give up, whatever it is, right?
Yeah.
It's
or they do it for a little bit and then they leave,
quit.
you know,
That's why you got to have the transactional business
marketing the new ones, you know.
Yeah.
So we're dabbling in the program. So I had started doing the programs already, and then we're wanting, you know, post program membership opportunity, and so we had to create the membership, which means everybody else had to get out of, you know, traditional way of doing it. So that was kind of the transition: is programs first, then we made this membership, then we got rid of insurance. So I mean, that was so stressful. And I'll tell you, you know, looking back on it, what I would coach people is the biggest mistake I made was not giving good scripting to my team. And so I was the one having to have all the conversations of why we're doing membership, what that's about and whatever. So I said I broke up with 2,900 people in the course of 5 months. Also, January to May was just way too long. Like, make it, you know.
Yeah, 21 days. Yeah.
Next month, whatever.
If I'd been coaching you then, it would have been a 21-day pitch.
Off. I didn't have you back then.
I would have been a 21-day pitch, and we would have had like some kind of teaser rate to get them in.
I was figuring all this out on my own.
I know.
Like,
I'm not giving you
any
shit.
coaching.
Yeah.
We had coaching to help with the programs, but they did not do any coaching on membership in, you know, anything else to do with kind of practice management stuff. So you know, I would say between, you know, bankruptcy, divorce, COVID, you know, like 2017, 2018, 2019, 2020, bad.
Yeah, well, you know, they go in cycles, right?
Yeah.
Like, I mean, I think that's one of the, you know, now at 58, you really do see the patterns in life. You know, there really is something to the whole 7-day cycle, like, or 7-year cycle, I mean.
Yeah.
Like, you know, the whole thing that they talked about in the Old Testament of like 7 days and, you know, or 7 years, I should say, not 7 days. It's really fascinating to me. There is a real cycle to it.
Yeah.
You know? So the thing for me is like when I was thinking about this as I was flying out here today, like when we met. So it was like November, I think, of
October of
21, October of 21.
Charlotte.
And I did a half day or a full day in Charlotte. And I remember I was talking about raising prices, and you said to me, I don't know if I got this right. You were charging what, 6,000 at the time?
8160 or something like
8160.
that. I had this perfect number of, you know, and it was like we needed to do about $8,000. Like when we started raising the prices from the 5,000, whatever. This was a 6-month program, and it was 8160. And so what I did with my office manager at the time is like, okay, let's just play with the numbers. Do we want 79? And I just like, it was like looking in a mirror, and we just, is it 8159? Is it 80,000, 8,000, whatever. And so we hit 8160. It was like, it just rolled off my tongue. I could smile while saying it. So like, that's how we decided what our pricing was. Like, it was much more like, how do you enunciate the word instead of like what number, you know, it needed to be. So we were 8160 for a really long time, and I was so proud of it. I remember walking up to you and I was like, my close rate is like 90%. And you're like, oh, you need to raise your prices. And I was like,
if your close rate's 90%, you're not charging enough.
Like, oh, you're amazing.
You are amazing, Aimee. You're fucking amazing. And
so what you told me, so one of my questions during that day was, I said, you know, we were doing 8160 and then crediting people $2,000 for their lab appointment. So I was doing this lab appointment thing at the time. And so we were giving them a credit back. Or I was saying, what should I do? Because people keep asking for that. And you said, well, just raise your price, you know, $2,000.
I think I told you, raise your price 2,000.
And so he goes, well, make it 10,000. Then you went, no, you mean make it 12,000. Actually, make it 14. So it's 14, and then you subtract the 2,000, and literally that was on a Saturday. We were there in Charlotte, and Monday, like my office manager at the time was there, Kimberly. Thank God she was there with me, and we literally came back Monday morning. We said, we're charging 14.
For the same package, for the same 6-month program.
We'd give them the credit of $2,000. So we felt good about that. And then, so we raised our price from 8,000 to 12,000.
And what happened?
Basically. and we sold the same amount, but of course got,
Way more money.
$6,000 more. And so, I mean, from that,
What was that like for you? What was that? Because remember you like called me, I think you emailed me on Tuesday, said I'm in. If that's the free advice, what's the paid advice going to be like?
Anything like that is scary, but I think having a support system, where somebody who has experience with this is giving you that advice, it's like, okay, well, you just got to try it and see what happened. I mean, surely if it didn't work, we could always go back to the 8,000.
You can always drop it back down.
Whatever.
Nobody ever does that.
So we did. And then, I mean, yeah, we were selling them, and, it was almost like, and that, you look back on it, and we'll say this now, the higher your prices, the more people buy them. It's ridiculous.
Isn't it?
It is ridiculous.
It's ridiculous, isn't it? It's the hardest thing for people to understand. It's one of the hardest.
Scared of, so now, from there, that was six-month program was 8,000 at the time. We went to 12 and then 14. Now it's 18.5.
And what's your business like now?
I don't know, because I'm not there. No, I do know.
No, you aren't there.
I do know. I'm not there.
Yeah, you're.
No, I mean, so it was slow moving at the time, and I can just tell you from gross revenue, it was less than $1 million in 2020 to 1.2 to 2.4 to 2 point whatever. We did 2.6 this year.
Yeah. But the interesting thing about that is you do 2.6, but you don't see that many patients anymore.
So 2.6, I actually had to pay $40,000 in taxes this year. So to me,
congratulations.
Thank you. That's a profitable business. So, we always look at the revenue and think, oh, I didn't grow enough. I went from 2.2 to 2.4 to 2.6. That wasn't very much, but now we're profitable. We're paying taxes, and I only work like 4 to 6 days a month.
You spent a lot of time in Cabo. We're here in Scottsdale. Yep. Every time I see your Insta Facebook feed, you are somewhere.
So the other thing that's happening is that my side gig, I just started this second, third, fourth business. I don't know. But I just created an LLC, one to pay my kids, because you can pay your kids and get a tax break on that. So I was learning all this, business stuff that I didn't know anything about. And so then I started coaching, and I started speaking, and I started doing all these things. And then all of a sudden, this side business that I thought was just a place to put some money was actually making money. So that was a 6-figure business last year.
And what's that? Tell us about that business.
So, well, I just call it ADMD LLC. So, I mean, that's, any kind of coaching, any sort of,
so you do some coaching
for Deb, she pays me. I speak for A4M, I speak for whatever. So any money that I get that's not patient related money that goes into Carolina Integrative Medicine is my side gig, is what I call it. And then I'm the medical advisor of Zymogen. And so there's a stipend for that sort of thing. So another side gig is I supervise nurse practitioners.
Let's talk about that, because this is an important thing.
Yeah, it's a very important thing. So probably 2 or 3 years ago, chiropractor that I know in Charlotte, Fort Mill actually, so not Charlotte, but came to me and said, we want to add a nurse practitioner. Would you be their supervisor? And I was like, what does that mean? But okay. And so we figured it out. And it was just this little thing on the side, whatever. And so then that nurse practitioner called me one day and said, hey, I'm gonna buy out the chiropractor, and I'm gonna hire another nurse practitioner. So I need you to be the supervisor for that one. And she had a friend who had a friend who had a, all of a sudden I have nine nurse practitioners that I'm supervising. So this is the side gig. And, I'm charging anywhere from $300, $600, $1,000 a month, depending on their number of patients. And so literally about a year ago in June, was in here. I was at Camelback Resort, and I'm like, okay, I'm gonna like grow this business, and I'm gonna go. We had this conversation.
Yeah, I remember.
I'm gonna go get licensed in all these states.
Yep.
And I'm gonna do all this stuff, and I'm gonna be a supervisor for a bazillion people. And that was, my idea. And then I had this moment, and I didn't really move on it. We talked about it for months and months. And why am I not doing this? Like, what's holding me back, right? And so I did this transcendence exercise one morning, and it was like, we're just doing weird stuff. What weird granola people do on the grass in San Diego. I thought it was Camelback. That was another weird experience of the energy of the mountains or whatever. And so we had this moment. She was like, think big. How can you be bigger? How can you be bigger? And I had this moment. I was like, I can't be bigger if it's just me.
Right.
And so even though I was going to go get licensed in all these states and be the supervisor, I was like, what happens to me?
Right. You then have a job again. You've just spent 15 years getting yourself out, and all of a sudden, this happens all the time, by the way.
Oh yeah. I see it with Deb particularly.
Deb particularly.
So, I was like, no wonder I haven't done it because I got licensed in Nevada and that was the only state because I was going to get the IMLCC thing,
Yeah, the compact thing.
whatever.
Yeah.
And so I had this epiphany June of last year that like, if I'm going to do this, I need it to be bigger than me. And so what I realized is that all these nurse practitioners are going and getting, BHRT certified, they're going to IFM, they're going to A4M, they're going to SAFM, all these functional medicine,
Mhm.
whatever. They are getting educated in this work that we're doing to help people. They're getting outside of the system and they're opening their own practices. And in 26 states, nurse practitioners have to have a supervising physician in
Yep.
order for them to practice independently. And so, there's a need out there. We have more patients than any of us can see. I mean, you see it. I mean,
It's
you wouldn't be in business if you didn't have
there.
doctors who had the patients, right?
Yeah.
So there are so many patients out there that we could help and so many, women, men, whoever it is that you're trying to help, live a better life and get on hormones and get their gut fixed and get their inflammation under control and all the things that we do in functional medicine. And so if these nurse practitioners, what they're finding is that they can't find a supervising physician that speaks the language. So they're like, I'm
And that's
paying
a
them, but
big
they
deal.
can't answer any
It's a
questions.
big deal, right? You
It's
can find the
huge.
supervising
They need
physician.
help. I
Right.
mean, like, the whole point of supervision is that you can call them, email them, whatever, and get answers to your questions. So they're either paying them with no real support and they don't know anything about them, or they can't find one that will agree to it because they think they're doing voodoo woohoo medicine. They know
Right.
nothing about it. And so they're like, I don't want to put my license on the line for this medicine. I don't know what you're practicing. Or they're getting charged, $5,000 a month for something that shouldn't be
Right.
expensive.
Yeah.
So these are all the stories I'm hearing. And so all these people are coming to me, let me know when you get licensed in Texas. Let me know when you get licensed in Oklahoma, whatever, whatever. And so I was like, I need to create this matchmaking service basically. So I invented Functional Medicine Collaborator is the business that I called it,
What's a
which
website?
is
Okay.
functionalmedicinecollaborator.com.
Okay.
Yep. And so it's basically a matchmaking service. So we have recruited, I think, 6 MDs now across the country, multiple licenses. I need a Georgia person, by the way. So if you're a Georgia MD that wants to do this,
I might have. I'll check
please
and see if I
find
have
me
somebody for you.
because I would say 8 to 10 nurse practitioners in Georgia right now that are ready to go, and I don't have an MD in Georgia. And the reason I'm licensed in Georgia, but Georgia law
You
is
have to
that the
be
practitioner that's a supervisor has to physically be
in
in
the state.
Georgia.
Yeah.
And so I guess I need to go buy a building in Georgia and do it that way if I need to, but
Let's just find you a
that's not my
doctor.
plan.
You know what? This is
Anyway,
it's
it's just come out of nowhere, and here it is, another business that is growing.
what would you tell with the wisdom you have now? What would you tell your younger self in 2011 that was going out?
Hold on for the ride. That's why I did a Mother's Day like breathing exercise or something, and it was like, go back to some time in your life, and I was like, hold on for the ride. But never give up is some like I literally I get because I do coaching, because I'm out there in this world and speaking and everything, you hear it all, people
Yeah,
ask you advice,
absolutely.
ask you questions. So I actually had a conversation in the airport today with a chiropractor who's had an experience where he had 2 nurse practitioners in his practice. Both have gone through BHRT training academy and then left and
Mhm.
opened their own business. And so
Mhm.
he's like, I don't know, is that a sign I just shouldn't do that? And I said, no, just don't make it happen again. Learn from it. Don't give up. There's plenty of patients out there that need your help. And just make sure that when you hire the next one that you put all the pieces in place that that's not going to happen again. So don't give up. Don't let these obstacles get in your way. Like, and that's where when I'm coaching, when I'm mentoring, when I'm supporting other practitioners that are going through opening their own practice or, helping with the people that you're working with, if I could just help them fast forward, let's not make the mistakes I made. Like I said, rip the Band-Aid off 5 months is way too little. Get rid of insurance.
Just
Let's
go.
just not even do insurance. But,
Yeah.
I mean, look at Josh. Like it took him forever to get out of that. And like
Yep.
he's so free now. And
Insurance is such
You
a
listen to us, it just, you can't you gotta get out of your own way
because
sometimes.
it's like getting
It's
off
very scary.
it's
It's
like
very scary.
it's like getting off of SSRIs, like, you
Yeah.
don't realize the damage it's doing to you.
Yeah.
I was at a party in LA and this guy came up to me and he goes, You're an entrepreneur?" I'm like, "Yeah, I'm an entrepreneur." I'm like, "Oh God, I know where this conversation's gonna go." He's like, "So I wanna start my own business. What do you think I should do?" And I looked at him, I said, "Don't fucking do it." It's just like he goes,
Never have
"What?"
a day off.
I go, "Just don't do it." And he's like, "No, I got this really good idea." It's like, I was looking at him, I'm like, "Yeah, no, I hope I didn't fire hose him." I'm kind of joking, but I'm kind of being serious. It's like a lifestyle. It's like,
Yeah.
I always tell people, it's like it's like taking a vow. It's like the vow of omerta in the mafia. You'd never get out. Like, it's like coal mining. Dust gets on you. It's never getting off of you. So,
I mean, there's no clocking in, there's no clocking out,
no.
I mean, you can work anywhere, so yes, I live the life of lots of travel, preferably travel to, tropical places that are warm and fun. I love it though. I mean, I love speaking, I love teaching. If I can help one person, live a better life of freedom that can help so many, my passion is to help people, right? Like that's why I went in, I delivered babies
You like to
for a
heal.
living.
You love healing,
I
don't you?
love healing. I love, I would say I went into this business bringing life into the world, and now it's like you get to restore life back to those who, are lost along the way. I mean, people are miserable and we can help them.
Yeah.
They don't have to keep being miserable. So
No.
it's
Well,
fun.
just kind of your final thoughts on this. Like, what do you see in the future for our industry? You were in it when we didn't know what the hell we were doing, or you were doing, because I don't practice medicine. But where do you see the industry going right now? What makes you excited?
Yeah, I mean, I think it's really good. The availability of the education is really exciting. I
Yeah, it's
mean, I know
amazing.
A4M's been there, but I didn't know about it. I went to this one tiny little conference. There was 20, not even 20 people in the room, right? In some
Shit, now there's
hotel in San
250.
Diego. Yeah.
Yeah.
Now there's 7,000, 8,000 people at
Oh,
A4M. Like I'm excited about that because I think we don't have to defend ourselves so much
mm-hmm.
anymore. I mean, the science is catching up. The big deal with estradiol being, off the black box warning and whatever. Like, I didn't really care because I'm like, I've been doing it for 15
Screw
years,
it. Yeah.
or 20 years now. But it makes it exciting because it's not so scary. It also makes it where everybody can do it now, or, they could do it before, but they are doing it now. So like, there's still a little, are they
Do,
going to come to us
what
because
would
they
you
could
say to
just go to
somebody?
their regular doctor, right? But,
What would somebody say that they're like, oh, now it's going to become too saturated that they're going to be able to get it anywhere? What would you say to a doctor that says
well, they're
something like
still
that?
not really doing bioidentical hormones. So are
No.
they testing? I mean, they can give people estrogen freely, but I mean, we have a lot of hormones in our body, like estrogen's just one of them. And so I still think progesterone's way underused. Nobody's testing adrenal and cortisol. And like, that's my favorite thing in the world to do. I mean,
Hmm.
nobody leaves it's now a white box, but every single patient gets a white box. So I mean, it's just growing. I think it's exciting. I think, the world of social media and chat and all that stuff can be scary, but it can also be informative for the patients. So they're coming in much more informed. They're coming in saying, I want, hormone replacement. I don't want to go the traditional route. I don't want all the medication. So, I think that they're coming in more educated and it's allowing us to, it's easier for us to sell, for lack of a better, I don't like the word selling, but
Yeah.
for help people understand what we're doing. And on the flip side, the traditional system is getting worse,
Oh
and so
God.
that's helping us. I mean, the amount
God, it's like, it's
it's just
just
worse and worse.
fascinating to watch
Yeah.
how bad it's getting.
I mean, less payments, less, it's not even about the money. I mean, the medical care is just sad.
I'm in the middle of hiring an EA. And so we've got, we're going through a network of people that we know and living in LA now. Like, there's a lot of carnage in the entertainment industry. So they're all looking for work.
Yeah.
Right. And so Christine sends us out to her list. And one of the questions that I asked, they go to a Google form. One of the questions they ask is, have you or a family member ever experienced the hell basically the hell that is the American healthcare
Right.
system? You should see the responses. It is like, it's a
Awful.
real
Yeah.
lesson
Yeah.
in how bad it is. People don't understand how bad the system
Yeah.
is. We do, because we live
We're
it every
in it.
day.
Yeah.
Yeah. But
Yeah. If you don't, I mean, luckily, if you don't have to experience it, but I think that we see it and we can see the bad in it, but I think there's so many things that happen that people aren't really even aware that that was a bad thing. Do you know what I mean? Like
Yeah.
they they,
Yeah.
you know, you get put on your statin, you get put on your whatever, you know, you walk out with 10 medications and you're like, cool, my doctor's really good. They're thorough and they give me all these meds, right? Like that's what people think like is a good thing,
Yeah.
you know,
Not good.
or they want me to go, you know, give my stress test every year. And I don't know. I mean, it's just silly, like all this stuff that
No.
would, you know, they told me I need a colonoscopy instead of Cologuard because I'm special, you know, like they're like just stupid stuff like that, right?
It
But
really
people
is.
think that it's normal. And so because that is happening so much more, unfortunately, you know, for the people that are experiencing it, but it's just helping us,
It's
you
totally
know,
helping us. I
'cause
really
we can
think
say you don't have to you don't have to live that way anymore.
I'll just say this. I think I've been in the medical space 11 years now. It's amazing to me how it has changed. I think in 5 years, I can't wait to sit down with you in 5 years because I think it's going to, the work you're doing, right? And the speaking you're doing and the coaching you're doing and what Deb is doing and what we're doing and other people out there like JJ Virgin, like all of them. Everybody's like, oh, aren't you worried? Like there's more competition? I'm like, no, it's more people spreading the message. It's
Yeah.
why when Deb was a client, we spent more time talking about her coaching program. And like,
Right.
she's like, you okay with this? I'm like, yeah, I've been coaching for 20 years. Let me show you how to build the system.
Yes.
Like,
Let's
you're
do
going to
it the
get,
right way, right?
let's do it the right way. Like, let me help you
Yeah,
reach.
that's why it's like, are you okay with having more practitioners that are your competition, right? Like there is
Fuck
no
yeah.
competition.
Yeah,
Like,
there
let me
is no
help you.
competition. Let's all, what did John Kennedy say? All boats in a rising
Yeah.
tide, whatever it is. I don't have it right. So
A rising tide lifts
there's
all
all boats.
boats.
Thank
Yeah.
you. See, this is why you have more college education than me. So,
I just heard it a lot.
well, Aimee, I appreciate you coming in. I'm glad we finally got this. We'll have to do a part 2 because I know there's even more to the story. But
It'll be fun.
how do people give them your site again for the
Yeah. So
supervisor?
functionalmedicollaborator.com or Facebook, you know, it's on Facebook, Functional Medicine Collaborator, Aimee Duffy, MD. You can find me. Carolina Integrative Medicine is my,
Follow you
know,
on Instagram. You got great posts between you and Deb. The two of you are like, I
and
always
I
know
don't
where the
do
two
it.
of you are.
So it's the key, you know,
Yeah, I
have
always know where the
somebody
two
else
of
that
you
does
are.
it for
Yeah, it's a blast. So, they're in Cabo this weekend. I got to get to Cabo.
Yeah.
Awesome. Well, cool. I'm looking forward to
Fun.
the next couple of days. You hiking Camelback Mountain while you're here?
I don't know. We'll see if I wake up.
Okay. I will not. So,
I
and
want,
then,
you know,
and
this
then
is
we'll
my
fly to
sick kids'
Dallas.
time,
We'll
so I'm
fly to
hungry.
Dallas and we'll speak at Boston BioLife
Yeah.
together. So
We will do that.
cool. Thanks.
Yeah.
Appreciate you coming in. All
Thank
right.
you.
If this episode got you thinking differently, hit follow and share it with someone stuck in the system. Please leave a review. It helps us grow. Want more? Visit mavericksprofitsystem.com to schedule your free discovery call and explore how far your business can go.